I'm Dr. Mark Richards, board-certified plastic surgeon practicing in Bethesda, Maryland. Welcome to Ageless Impressions. Today on Ageless Impressions, we're going to discuss bioidentical hormone therapy. Now you may ask, what does bioidentical hormone therapy have to do with anti-aging, with making me feel better, with improving my sense of well-being, with my health? Well, it has everything to do with it. In fact, testosterone, which is what's contained in these little vials, is the most ubiquitous, most prevalent bioidentical hormone in both men and women their entire lives. Testosterone is one of the oldest hormones evolutionarily. In fact, testosterone creates many of the substances that we need to prevent disease and improve our health. For example, 100% of all the estrogen inside your cells is made from testosterone. Testosterone is actively transported into your tissues. Estrogen is not. And both men and women require the same cells to have the same amount of estrogen in them. Obviously in men, they don't produce estrogen in their testicles. So where does all this estrogen come from? Well, it comes from testosterone. Without testosterone, your body is deprived of estrogen, which means that you don't sleep, you feel fatigued, your bones start to get thin, and many other issues. Testosterone not only makes a number of other substances in its metabolism, but it also makes other hormones and factors in your system that are critical for your health and well-being. For example, testosterone directly increases a substance called interleukin-10. What is interleukin-10? Interleukin-10 is one of the most powerful anti-inflammatories that your body makes. In fact, in the animal model, testosterone reverses plaques in arteries. No one's yet done the study in humans, but we know that when humans have high testosterone, men or women, their risk of heart disease, strokes, and atherosclerotic plaques in their arteries is greatly decreased. In fact, studies have shown that an increase in testosterone increases friendliness, sense of well-being, and decreases anxiety, irritability, aggressiveness, and depression. The old story about testosterone causing anger and aggression is a false story. In fact, testosterone decreases aggression, increases friendliness. The hormone that creates anxiety and aggression is actually estrogen. There are many false stories circulating about testosterone. In fact, one of the big scares is that it causes cancer. In fact, nothing could be further from the truth. A recent study published showed that women on testosterone pellet therapy, which we will discuss in a minute, decreases the risk of cancer in women by over 50%. Many times, a doctor will tell his patient that men taking testosterone will end up with prostate cancer. Again, nothing could be further from the truth. Studies have shown that testosterone in the bloodstream, combined with a common protein in our bloodstream called albumin, kills prostate cancer cells. So your next question might be, well, is testosterone cream or gel the same as testosterone injections? Or are the pellets contained in this bottle actually the most important thing you're going to learn in this show? So what exactly is in this little bottle? There is a sterilized, highly compressed testosterone pellet. It's about the size of a Tic Tac, and this therapy has been used in men and women in the United States since before 1940. In fact, it was a very common form of therapy until the 60s when the pharmaceutical industry started making mock hormones, meaning hormones that aren't something your body produces, but rather a different molecular version of that so that they can be patented and profitable. This therapy is the only therapy of testosterone that provides a steady state availability of testosterone for months at a time. So we have one of our repeat patients today, another satisfied customer, who volunteered to let us show you her insertion. So the upper outer buttock of women is usually an area that has enough fat to have the pellet live until it fully dissolves. I'll make a little mark where I plan on putting the poke in the skin, and I'll make a little X for where I'm going to aim to place the pellet. The procedure is very simple, and except for the skin injection of the local anesthetic, completely painless. So I'll put a skinny needle into the skin, little pinch, and then put in some local anesthesia. And we'll give that a minute to work on the skin. And then I'll put the rest of the anesthesia into the fat. So far, Laura's been a great patient, no screaming, but actually it really doesn't hurt. Just the first injection into the skin is the only thing that's painful. The fat doesn't have very many nerve endings. The beauty of these testosterone pellets, besides the fact that they have steady state availability and release into your tissues, is the fact that there's nothing left. At the end of a few months, the pellets are gone. So here's the little bit that's needed to put in the pellets. We have the bottles of sterilized pellets, a skinny little scalpel blade to poke a hole in the skin, sterile gloves, and a sterilized insertion tray. Okay, it's now been 7 minutes, which gives us local anesthetic and the epinephrine in it time to act. You can see the little white spot on the skin where I injected the local anesthetic to constrict blood vessels and make it so this would be a painless procedure. And these are the small pellets that our patient will be getting today. This is testosterone plus an aromatase inhibitor called anastrozole in the pellets. This patient is still having her periods, so it's required for me to put an aromatase inhibitor with her pellets to decrease her estrogen state. This is the small poke in the skin. As you can see, it's extremely tiny. This is the metal trocar, or the metal straw as I call it. It's only 3 millimeters wide, and we put it into the little poke in the skin and push it towards where X marks the spot. There's local anesthesia in there, so she didn't feel a thing. Now you pull the center of the straw out, and I bring my little pellets, put them in here. And then there's a plunger that pushes the pellets into the fat. Then everything comes out, and that is the end of the procedure. So as you see, it's a painless procedure. It leaves a very tiny poke in the skin. You can't find where her other incisions were back here, or pokes in the skin to insert pellets in the past. And really, it's a non-event. I put a little glue around the skin, and then I use elastic type butterfly tape to close a little hole. I like the elastic bandages because when she sits and moves as the buttock shifts, the little skin tapes move with her skin as opposed to giving her blisters. Her restrictions after this treatment are pretty simple. She can start doing exercise such as exercise bike, elliptical, and weightlifting in about 3 days. But for 7 days, I don't want her to immerse herself in water such as a bathtub, hot tub, swimming pool, or to do high-impact activities such as tennis, jogging, or basketball. You may wonder, isn't my natural decline in testosterone something that should be happening? Well, the answer is yes and no. In fact, your testosterone today is probably 60% lower than it would have been at your age in 1960. How did this happen? How did you get testosterone that's over 60% lower than what it used to be or should be? The answer is plastics. Plastics are created with the use of chemicals called phthalates, and phthalates are the most powerful endocrine disruptor we have ever created and put into general circulation. Examples of phthalates exist in every piece of plastic you come into contact with. 95% of the drinking water in the US from the tap has microscopic plastic in it. Your sunscreen has phthalates in it. Your makeup has phthalates in it. Your food comes in contact with packaging that has phthalates in it. Cans have phthalates in them. The most well-known phthalate is BPA, which has, quote, been banned in most applications. However, there's 3 dozen other phthalates that are used in manufacture of plastic, containers, liquids, and work their way into our water and food system. The personal and societal costs of phthalate-induced low testosterone in men and women is astronomical. The European Union did a study a few years ago which showed that the phthalate-caused low testosterone in a small group of men aged between 55 and 64, was costing the European Union 15 billion euros a year in both healthcare cost and lost productivity. If you magnify this loss by men of all ages and women of all ages, you come to some astronomical healthcare numbers. We can really no longer afford, as a country, to ignore the fact that low testosterone is perhaps the leading cause of increased healthcare dollars. After insertion, your body will start repairing the damages it's experienced from your low testosterone state. Improvement of symptoms and improvement of your health will happen gradually over the following weeks, months, and even a year. Typically, after insertion, within several months, people noticed their sleep is back to what it used to be, their sense of well-being is back to what it used to be, their body fat is starting to go away, their bone density and muscle mass are starting to improve, and in general, they wake up energetic, looking forward to the day. However you were in your mid-20s is how you can hope and expect to feel after starting testosterone therapy. So, for example, if you were depressed in your mid-20s and required antidepressants, then testosterone therapy probably will not cure your depression, but it should improve it somewhat. However, if your depression was something that was diagnosed when you were in your 40s, but you never had it in your 20s, and it's not due to situational issues, then many times testosterone therapy allows you to get rid of the need for antidepressants, because the depression is a low testosterone-induced depression, not actually a brain neurochemical-induced issue. Many things can create low testosterone states besides phthalates, things such as substance abuse, alcoholism, and in particular narcotic abuse. The danger of narcotics is that within 2 hours of consumption, a narcotic can reduce your testosterone levels by 80%. Furthermore, stronger narcotics, such as in pain management clinics, intrathecal injections of narcotics, can cause a permanent, irreparable decrease in your testosterone production. Because narcotic consumption can potentially induce a permanent lowering of testosterone levels, people are experiencing anxiety, irritability, fatigue, loss of a sense of well-being that can actually drive them back towards starting their drugs as they self-medicate. I personally believe that testosterone therapy in people who have been on long-term narcotics, either legally or illegally, would greatly assist them in reducing their reliance on these drugs and their desire to return to them. So who are my patients for this therapy? Well, in fact, my patients range from being in their 30s to being in their 90s. Testosterone improves your visual spatial orientation, which means you're much less likely to fall. So you can imagine how important that is for elderly people. It increases your bone density, so you can imagine how important that is for elderly people. It makes you wake up in the morning feeling more energetic, like you used to be. Testosterone therapy has proved to be not only a benefit for the individual who is receiving the therapy, but also for the entire family. Because when the parent or parents are happier, more energetic, less aggressive, less angry, less irritable, everybody around them benefits, from their coworkers to their children to their spouse. A discussion of testosterone therapy wouldn't be complete without a discussion regarding sex. The media seems to focus on testosterone therapy as being solely for sexual issues. That's not true. However, testosterone therapy does improve sex for the same reason it improves all the other aspects of your life that were better in your 20s. Why does that happen? Well, for one thing, testosterone therapy does create all the estradiol inside the cells of your body, which means that things such as vaginal dryness go away. When your testosterone's low, your nitric oxide is low. And when your nitric oxide is low, your erectile tissues cannot get firm or dilate as they're supposed to. This has large implications in both men and women, as both men and women's sexual function is dependent on their erectile tissues. The common drugs for erectile dysfunction are Cialis, Viagra, Levitra, and so forth. These drugs work on decreasing the breakdown of nitric oxide in the tissues, but none of them work on building up the nitric oxide supply. This improves the nitric oxide supply, and hence why the media focuses on sexual response as being improved with testosterone. While this is true, it is only one of many other benefits. For example, testosterone increases a substance in your body called IGF-1. IGF-1 is what makes your cells sensitive to insulin. When testosterone is low, the rate of diabetes and metabolic syndrome is increased by 300%. I've treated diabetics with testosterone therapy who are able to decrease or stop their diabetic medication because of the increased sensitivity of their cells to insulin. People often ask me what my patients' reactions are to this therapy. Well, the first one is, why didn't my doctor tell me about this? Well, the answer to that is that, unfortunately, we're not educated about it. No one is spending time and money to educate physicians about a therapy that's a generic product. The second reaction is, you changed my life. Well, how did I change your life? And the answers are varied depending on the person. It can be anything from, I was ready to retire and now I started a new consulting business and I'm traveling around the country helping firms, to my wife and I were discussing separation and divorce and now we're really happy again, just like we were when we were younger. So why haven't the doctors been educated about this? Well, the sad reason is that there's no money in making these pellets. It's a generic substance. There's many compounding pharmacies that can make it, although only a few of them, in my opinion, are really excellent medical grade quality that should be used. And therefore, since the margins are small, there's no leftover money to spend educating doctors about this substance. Many doctors have been educated about the advantages of things such as testosterone gel, which is a patented product. Even though the testosterone is generic in it and can't be patented, the carrier for the gel can be patented. And they prescribe that all the time. Unfortunately, an excellent study that was done inside hospitals and outside hospitals showed that testosterone gel only reaches therapeutic levels 22% of the time. And when it does reach those therapeutic levels, those levels are gone within 8 hours. It's a poor delivery system, and it's a poor way to treat low testosterone in men and women. On the other hand, testosterone pellets, which have been used in this country since before 1940, provide steady state availability of testosterone to men and women for months. While testosterone provides estradiol for all the cells in your body that require estradiol, too much estrogen is not a good thing. How do I control how much estrogen your body makes out of this testosterone? In fact, there's an excellent delivery system of a drug that decreases the enzyme that converts testosterone into estrogen. That enzyme is called aromatase, and we use a tiny amount of aromatase inhibitors in testosterone pellets for people who are predisposed to having high estrogens. When your estrogen is high, you have a much higher risk of developing various cancers such as breast cancer, uterine cancer, maybe even prostate cancer. Genetically, we're all programmed differently, and we have a different amount of aromatase activities in our cells. So after careful measurement and follow-up with you after your testosterone pellets, we determine how much aromatase should be in your pellets to keep you in the ideal balance. For example, many women develop menopausal symptoms such as depression, anxiety, irritability, increased fat around the lower abdomen, not sleeping well, loss of libido, long before their ovaries stop producing eggs, which means that these women are still producing high levels of estrogen. They benefit greatly from testosterone pellets, but testosterone pellets with an aromatase inhibitor in them. This usually improves their periods, the symptoms they experience around the periods, as well as reverses all those changes that they noticed occurring to them. Interestingly, it's not just women that can overproduce estrogen. I would say approximately 70% of my male patients on testosterone pellets require an aromatase inhibitor in their pellets as well. I can't say if this has always been the case or this is a result of estrogens in our environment. However, it is equally important in men to keep their estrogens at a normal but low level. When we return, we will discuss the mythology about testosterone and bodybuilding. We've all heard of weightlifters who have taken drugs that are steroids at the gym. Well, they're not taking testosterone alone. They're taking other drugs that bind to both the testosterone receptor and the estrogen receptor. Estrogen is a fertilizer to cells. So without activating the estrogen receptor, these bodybuilders cannot get massive muscle growth. Unfortunately, since it's a fertilizer to cell, stimulating the estrogen receptor also greatly increases your risk of various cancers. You may recall many stories of weightlifters that have taken a drug called Danabol, which indeed makes them huge and very muscled. However, that kind of muscle increase comes with a huge cost. You also read about the weightlifters taking Danabol that develop brain cancers, liver cancers, kidney cancers, testicular cancer, and so on. That is from the overstimulation of their estrogen receptors. The level of delivery, control, and estrogen to testosterone ratio that these pellets provide explains exactly why they're critical for every industrialized society in the world.